And we're live.
Alright you guys, we're now going to start microneedling. You can see these little needles here. And we're going to put PRP, show them the PRP. That's our blood plasma. We've already done our Forever Young BBL, which has done really good. Nice mild redness. Some areas will be a little darker where we got some of the blood vessels. And now we just lightly microneedle. And our idea here is to get mild pinpoint bleeding. Nothing crazy. This will just keep her looking young, rejuvenate. It's collagen production. We overall are using these needles. Go ahead. We're putting that PRP on the skin. You can see it going in. We've already done the light therapy for, the redness, the blood vessels. You can see this will help now the texture, any scars, fine wrinkles. We just overall want to get her an improvement. We always work, around the mouth a little bit more to help the pores, or pushing the PRP in. Fine pinpoint bleeding is really all you need. And this works very good in complement with laser, with light therapy like we just did with the BBL. It's going to improve,
Now, ouch.
sun
Does
damage.
it hurt?
How does this feel now?
Oh, it's just like a little pinching.
Little pinch, nothing big. And you can see she's mildly red and has some a little bit darker areas in certain areas of the vessels. But this is it. We literally go back and forth. This is something people can do every month to keep their skin looking good. This is something you can do quarterly. It's just something you want to maintain. What's nice about it is, turn to the right now. The downtime is much less than if you were laser. Because the needles don't have heat. So they're really just causing mechanical stimulation. Some people call this collagen induction therapy. Forehead hurts a little bit more.
Where's the needles depth?
What?
The needles depth.
I always think below 2 millimeters is plenty. We're doing 1.5 millimeters to just get her a nice tightening effect.
How many pins does that have?
What?
How many pins does that have?
How many pins? I don't know how many pins the skin type has. I always forget. There's so many different companies now that have them. The Exceed pen has a smaller number and spaces them out. How many does the skin pen have? 6?
And 12.
Oh, 12 on these. Yeah, 12 on the pen, this skin pen. But now everybody's getting into why theirs is better than the other. And really, to be honest, it's based on, in my opinion, how the patients feel. Yeah, exactly. We like to go a little bit more around the mouth, especially in this lower area where people get wrinkles, fine pinpoint bleeding. She's a pro, you guys. She's a pro. And we're going all the way up.
This is
to the
PRP.
edge. This is PRP microneedling.
Now, how much depth do you go for scarring?
I don't usually like to go more than 2 millimeters. I don't think it makes much a difference unless somebody had like really a keloid scar. It's the number of passes, in my opinion, and the time spent on the tissue that I think makes more of a difference. Which is why we're going to do, 3 or 4 full passes for her to improve overall quality, especially in this crow's feet area, her under eye area, her pores. We really want to get her pores. We're now going to put on one of our favorite new devices, the cryo unit that is attached directly to an anchor so that we can get this covering the patient being treated while we are treating. So go ahead and she'll show you.
Now, can this procedure be used with people of color?
Oh yeah, this can be done on any skin type at all. Turn your head to the right now. So now we're going to start down the procedure a little high, probably at 4 or 5. And we're going to face the cryo unit directly on her skin And this is almost like doing a cryofacial, but it's cooling down her skin. There we go.
Now, can you do this with a laser?
You can do this with a laser. How does that feel? Does it feel a little cooling?
Yes.
Good. Because that's what you want. You want to get the skin to calm down. Almost done. Turn to the left now. And go right along her jawline. Get a little more tightening there.
How much could this help with acne scars?
Well, this can help a lot if you can continue the treatments, but you'd have to do a lot of treatments to see that type of result that you'd want for scars. You really need to do lasers and combination therapies. Check out our Instagram about combination therapies that you can use for scars. And then the key is the aftercare. Okay, emeragecosmetics.com. We have package information on what you can do for microneedling and also post laser, and then what you would do for her after this treatment. So that's really it, you guys. She did.
And then one more time for those that just tuned in, what are you doing and what is this called?
This is called microneedling with PRP. Turn your head this way.
What do people call it?
Some people call this a vampire facial, plasma facial. We're now just treating her after we've done BBL. We call this a bright and tight, okay, because we did BBL for brightening, and now we're doing microneedling for tightening those pores. See you guys. Have a good weekend. Bye. Bye, guys. All right, perfect.